Hello everyone, welcome to the Labonyx Bltztorm. This is a an, this is the Labonyx Bltztorm in around this editorial edition as part of Bostix Bostix news, and an editorial as part of this editorial edition, aligned with another Storm Bostix production, a Pathslide and a Cavalcade. In this the Labonyx Bltztorm, there will the overview in around this will be in around sort of the importance of renal diagnostic screening, and where this works was works was a collaborative, sort of originally from works from 2013, line to works that have been sort of presented, aligned to the Bristol Research in Practice Annual Symposium, and where collaborators were between two academic institutions, one NHS trust in the southwest region of the United Kingdom, and a community, and where collaborator was also had been, well, one of the collaborators had been from within sort of a community pharmacy setting as well. So a bit of background around this, in this and this works around the importance of renal diagnostic screening in community. So chronic kidney disease, or CKD, is a long-term condition, has been described in literature as sort of the gradual and usual permanent loss of renal function over time. Early in disease process, suspect or high risk patients in the population with often often can experience no symptoms or symptomology, and symptomology, and CKD has at the same time, has at the same time for a long time been an underdiagnosed condition. Even in the absence of symptomology, CKD appears to add significantly to the impact and burden of particular comorbidities and mortality and morbidity. At the same time, first and possibly the most important in around this is the incidence the incidence of the disease, or in around the disease, has been changing. In addition, the age of suspect or high risk patients entering into CKD has increased sort of progressively, and patients with particular comorbidities um, uh, comorbidities can also can also find can find them can be again suspect or high risk of in around CKD, aligned to other, for example, primary conditions as well. And currently diagnostic investigations and currently uh, diagnostic investigations, in around medicines as well, medicines and ongoing treatments for renal disease are provided in context of by the NHS, by the National Health Service, and hemodialysis or renal replacement therapy treatments can cost the NHS it can cost the NHS anything between £20,000 to £25,000 per patient per year, as sort of documented and evidenced by the National Service framework for renal services retrospectively in 2005, and unfortunately, most suspect patients or recipients are referred to sort of nephrologists only at a time, unfortunately, when renal function is close to the level of detriment, and when renal replacement therapy is required, and that is when, unfortunately, not much can be expected from conservative kidney protective treatments. In around this sort of collaborative works, there was in around this sort of collaborative works, there was a hypothesis and some specific aims. So since the in around the hypothesis first, so since the implementation of what have been referred to as the New Pharmacy Contract, or MPC 2005, instigated by Primary Care Trust, and the Pharmaceutical Services Negotiating Committee, PSNC, the community pharmacy is now able, or had been able to provide sort of what have been referred to as enhanced services, and it would be advantageous to explore or identify a viable, feasible renal screening program in context of community pharmacy setting. And the aims around this collaborative works, was to highlight the importance of renal screening in a community pharmacy setting, and prospectively highlight where community pharmacists, for example, can initiate novel screening programs in around preventing CKD, chronic kidney disease. Some basic concepts in screening. So community pharmacists who can either work in community based or hospital based, and those with access to electronic patient records also require to be sort of familiar in around screening investigations, screening investigations, and in around the test parameters and what they mean. Screening and sort of the test parameters can be expressed as sort of qualitatively, quantitatively, or quantitatively. Hematology and sort of biochemistry investigations are generally expressed quantitatively in reports, and these can help, for example, can help health professionals sort of interpret specific clinical or biochemical parameters, and correct interpretation and correct interpretation could help, or can help in align to sort of care plans and interventions. Not all laboratory data, for example, are direct relevance, but a general of these is recommended in order to understand sort of symptomologies. So in around the importance of renal diagnostic screening context of prevention and monitoring disease. So the number of patients taking into renal replacement programs, or RRT programs, has unfortunately increased over the decades, over the last few decades or so. And the national sort of retrospectively, the national services framework for renal services had from sort of 2004 and 2005. So parts 1 and parts 2, had been guidelines, as had been set as guidelines or practice in context of practices of how services for renal patients, or in context of renal care sort of more generally, should be carried out throughout the United Kingdom. and specific programs should promote early detection of CKD and comorbid conditions. A use of appropriate outcome measures to clarify patient care, implementation of strategies to delay disease progression and/or prevent or threat prevent threat in line to complications. The consequences of late referrals have include increased morbidity, mortality, and a detriment to the utilization of appropriate of appropriate of appropriate appropriate sort of aspects of commissioning and resourcing. So in line to near patient testing or in context of literature where near patient testing terminology is used in synonymously with point of care testing or POCT. So near patient testing or POCT screening in sort of the pharmacy and community pharmacy, for example, a setting can be utilized to fulfill three main objectives. Number one, to assess the risk of disease. Number two, to screen the presence of disease. And number three, to manage disease. Point of care testing or near patient testing screening offers an opportunity for community pharmacists to enhance blood services, blood services, and both blood and urine investigations, for example, can be used to investigate renal function or renal insufficiency. And in terms of blood samples, the substances of intrigue would be, for example, serum creatinine and blood urea and nitrogen or BUN. Now, in line to point of care testing, and where point of care testing is where point of care testing is linked with is sort of linked with or with advice or guidance, if you like, in context of at least in context of pharmacy practices or the pharmacy setting. Medicine use reviews or MURs sort of have a basis in context of sort of advanced as an advanced sort of service aligned to the NPC 2005 retrospectively. So MURs or medicine use reviews allow community pharmacists to provide sort of a basis or an emphasis on drug formulations to help reduce, for example, nephrotoxicity in suspect or high risk patients, and thus prompt sort of enhancing of communication, for example, between general practitioners and sort of pharmacy, and allowing sort of collaborations in context of primary healthcare. MURs are also important because they can allow expertise to prompt sort of a better monitoring of drug interactions and contraindications, which is important in where the metabolic and elimination systems are important in suspect or high risk CKD patients in context of in context of the community and population health. Now, the acceptable daily intake and safety limits of excipients, for example, for some suspect or renal impaired patients, at the same time can lower sort of renal lower renal elimination and kidney malfunction and implicate and sort of negatively implicate kidney function, and thus must be and where renal function must be checked. So in around this as well, some sort of a link to aspects of of practice in this context. So retrospectively, the NPC 2005 had documented advanced and enhanced services, where, for example, community pharmacists can play can sort of have enhanced roles to allow enhanced basis to allow better self-care approaches or interventions for suspect or high-risk patients in aligned to community community environs, and provide service providers, policymakers should view CKD as a sort of as a concern in the context of public health, and where and where there from and where collaboratively um, uh, could and should prompt and encourage health professionals to address the issues in around the CKD, the suspect or high risk CKD population. So in around overall conclusions. So an effective sort of system that would require would require sort of databases that code for example, age, ethnicity, and looking at renal function, as well as diagnoses, screening programs in community, in around the community pharmacy setting, and around the hypothesis, still requires testing and investigating, and at the same time, it would be viable to detect renal insufficiency in a community pharmacy setting. So that draws this podcast this overview in around this the Labonyx Bltztorm, and around this the Labonyx Bltztorm overview to close. There will be some resources or references, citations that listeners can check out in the description and around on social media. Aligned to this works to identify works, some works that have been evidence in context of the literature around this works. This has been an editorial edition, part of Bostix News, part of the Labonyx Bltztorm, a Storm Labostix. It's been a Storm Labostix Productions, a part of a Path Slide and a Cavalcade. Thanks for tuning in.